Hey, what's up everybody? Today I talk with Andra Millian. She's an acupuncture and traditional Chinese medicine master about how she treats symptoms related to COVID-19. I'm Risa Morimoto, your host, and you're watching Modern Aging, where we chat about innovative, holistic ways to optimize our health and well-being as we age. You click on that cute little red button below that says subscribe on it with that little bell next to it. You'll be sure to get notified whenever a new episode is uploaded. You can also sign up onto our email list and get the news of our latest and upcoming programs on our website at thisismodernaging.com. So many of you may already know about TCM, or traditional Chinese medicine. It's one of the oldest medical systems going back thousands of years. Millions of people all over the world are being treated using acupuncture, cupping, herbs, and so many other things. I've done cupping, scraping, acupuncture for years. Its philosophy of prevention and creating balance in the body is one that's helped many people who are suffering from so many different ailments. But today, we're going to focus on coronavirus symptoms. So check it out. Today we're going to talk about TCM, traditional Chinese medicine.
Yes.
So before we kick it off, why don't you just explain a little bit about what TCM is for those who may not know?
So TCM stands for traditional Chinese medicine. TCM started about, there's varying stories about it, but 2,500 to 3,000 years ago,
give or take,
in China, which is a very old, country that has kept a history of written, it's kept a written history for a very, very long time. So even though Western medicine is said to have started in ancient Greece, the thing with Western medicine is they've sort of throw out the old to bring in the new, as science progressed and everything. Chinese medicine just kind of keeps all of their records. And so there are really ancient records about some of this stuff. The thing about Chinese medicine, obviously I am not Chinese. I did not study in China. It's pretty much all over the world now and is being practiced a lot in Europe and the United States. I went to school in California. My teachers that ran my school were from Taiwan. Some form of this old Asian style medicine is practiced really ubiquitously all over Asia. Taiwan, Japan, Vietnam. My acupuncture teacher was Vietnamese.
What are the components of TCM?
So most people know acupuncture, right? That's what most people know it for. And there's also a lot of other physical modalities like that help with pain and inflammation. There's body work called Tuina. It's like a type of massage. There's different acupressure. There's the cupping that people kind of see, or that the athletes have now, that kind of helps with circulation and things like that. There's a thing that's called scraping, that's gua sha. There's also exercise, which includes things like tai chi and qigong and these kind of movements that keep people supple and aging well. There's a whole way to eat within the seasons and to eat for specific ailments. In Western nutrition, they say, eat a lot of colored foods and eat a lot of antioxidants and blah, blah, blah. But in Asian medicine and Chinese medicine, there are really specific foods that actually help you through different types of ailments and things that you should lay off of if you have certain types of ailments. So that's a really interesting aspect. And then there's also the whole herbal cornucopia, which over time, has evolved. Obviously, there, in China still there's things like, endangered species and kind of black market things that are really, not used over here, and things that are not legal over here. But we do use a lot of herbal medicine for internal ailment. A nice broad course of study that I got really interested in because it helped me. It helped people that I knew in really specific ways, and I figured this would keep me busy into my old age because there's so much to it,
Yeah, so. No. I feel like everybody's probably heard of one element of that, right? Whether it's Qigong, Tai Chi, or acupuncture, or whatever, not realizing that it all falls under a big umbrella of TCM.
Right.
So I know you've had a lot of patients coming to you about COVID, asking you about either treatment, and you've been helping some of your patients.
I treat a lot of older people. So before we had lockdown here in the state of Texas where I live, I locked her down pretty early because I treat a lot of people with, pre-existing conditions, with autoimmune issues that they're also seeing medical doctors for in conjunction with them, and I treat a lot of older people that are at risk. So I thought, okay, just do what can you do online? And I also figured, most of what we do in the clinic are things, the more physical medicine, the acupuncture and things like that. And really for kind of what was on deck at the time, I felt like I could be of more use, of the most use, and put good use out of just this type of, phone consult, telemedicine type of a thing. Because what's happening in the Western way, they're doing their thing and trying to find, the cures and the vaccines and all of that takes time. And really at the time, the best thing that they were offering was just stay away from other people and wash your hands a lot, And so I was getting people calling and saying, well, I don't know if I have a cold or an allergy or if it's this horrible thing going around. And, I have these symptoms and that symptoms. And so I started to talk to people about things that they could specifically do with a Chinese medicine diagnosis, which is not COVID. COVID is a, modern medicine, diagnosis of a virus. When Chinese medicine came on, into play, most of what we study, it's a huge part of what we studied in herbal medicine, is a thing called the 4 levels and 6 stages of febrile diseases. Because in China, over a 3,000 year period, they had a lot of sort of, things that invaded their systems, whether it was, cholera or malarial things or, fevers that came and went. And so they developed different herbal protocols and different sort of sets of symptoms to look for, where they would then make an herbal formula, which is up to about 20 herbs sometimes, to treat those groups of symptoms. Do you have a cough? Is it a productive cough? Is it a dry cough? Do you have a headache? Where is it on your head? Do you have a fever or not? Are you feeling chilly or not? All of these things are kind of grouped, and they all have these different, really interesting and quite effective, in a lot of cases, herbal formulas that go with them. And so, I've been working for about 20 years on this, and for, seasonal allergies, for colds and flus, for the first sign of like a sore throat or something like that, you can really help people out pretty quickly. And so whether a person has COVID or not is really kind of beside the point in Chinese medicine. What we're trying to do is get those first symptoms handled so that you're able to, chase the thief out of the house faster, is what they say.
So the key is to get it as soon as you start feeling the symptom, whatever that may be.
They say, and prevention. They say don't wait until you're dying of thirst to start digging a well. That's one. So, you start with just getting your body strong, depending on what is up in the seasons, right? So, in the winter, we have different things that hit us in the winter, usually having to do with dampness and cold and, colds and flus that come along. We call those, toxic toxins, airborne toxins. That's what they called them back then. And if you go far back enough in Chinese medicine, it was ghosts and things that came in the air, So, that's all been updated. But, we look at things like that. In the spring, people get a lot of, sniffles and sneezes and upper respiratory things just from allergies and things like that. There's certain times of year where you're kind of stuck inside and you're feeling, more weak and low energy. And, Chinese medicine says that's a stagnation of your vital energy, so we try and get things, moving that way. So in Chinese medicine, in the old days, the doctors did not get paid if anybody got sick, because back then, there were no antibiotics. There was nothing like that, right? So the whole thing of their medicine was to try and keep people well, right, and to try and mitigate whatever symptoms came along as quickly as possible before it got out of hand for them to be able to even handle it. And so there's a lot of things in the earlier phases of illnesses that are effective, and then there's things recuperatively that are effective.
So
and
would they actually use a different herb depending on where the headache is? Like you'd use a different herb for the front or the back or whatever?
Yeah. So the way that the thing that's different in like European herbology. I mean, Europeans had herbology, from the ancient Greeks to the Germans. They have a whole, pharmacopoeia of things that are used. Chamomile is good for this and lavender is good for that. In Chinese medicine, what's so nice about it is that they usually do groups of herbs and they can put them in about 20 at a time. So you have the chief herbs or the king herbs or the emperor, depending on where if you're mainland Chinese or not. You have the main symptom, the main thing that it's treating. And then you have other herbs that increase those effectiveness. You have some herbs that will cut any kind of toxicity or side effects from that combination. And then you have things that actually send them, you're going to do like in over-the-counter Western meds. You have a headache preparations. You have things that help your stomach. You have things that help your back. You have things that help your joints. They call those the envoys, and they send them either to the joints or to the upper part of the body or lower part of the body.
Wow. So how would you say, I know this is maybe a crazy question, but acetaminophen, right? They say to take that for a headache and for headache symptoms with COVID. Now, that is technically allowing more blood flow into the brain. Are the herbs doing the same thing, but just doing it naturally?
Gentler, usually, a little gentle. So you don't have, especially if your body is a little delicate, you don't, and especially if you're on a bunch of other medications that have to be processed like through your liver, and older people especially are on a lot of meds. And so we try and do things as much as possible that are going to help somebody without adding to that load. And so that's where, the herbal preparations can sometimes be a big help, because they don't stay in the body as long as some of the Western meds, so they don't have the, toxic load that some of them have. Mm-hmm. And they're very effective without kind of, I'm going to take this antihistamine, but I'm going to feel really wiped out for a day after. I'm going to feel so dry afterwards. But, my headache's gone, but I have this now, or my, my stomach ache's gone, but I have this now. And so, you can do it a little gentler. And also what I've been doing a lot with these consults is actually talking about, foods that are good, because everybody's got food, and people tend to want to comfort themselves a lot right now. And sometimes that's a little counterproductive. So I sort of, I'm trying to lead people towards, eating well, but targeting it a little bit.
Mm-hmm. That's great.
Kind of help.
So would you say, though, sometimes they say that a lot of the herbal meds, it takes time for it to start, benefiting you. Would you say that this is more immediate because of the potency, or?
Yeah, no, it's the types of, there's different types of herbs. Usually, I think what you're referring to is tonics, things that are, maybe a little bit immunostimulant, things like, echinacea and reishi mushrooms and things that have to kind of stay in the body, that are meant to strengthen the body over time. The things that people in the, vitamin and supplement and functional community put into like adrenal fatigue supplements and things like that. Those things that are tonics that tonify and strengthen the body. That's a really important thing too, because people are kind of wanting those things now. Well, what do I take that's going to, boost up my immune system? And you have to be really careful with those types of things, which do take a little longer to, you have to be on them for maybe 2-3 months just to buck up. But you don't want to be taking a lot of tonics. In Chinese medicine, they say you don't want to lock the thief in to the house. You don't want to lock the thief in your house. And so if you tonify, even if it's a lot of vitamins, taking a lot of multivitamins and things like that, it'll strengthen your system, but it also tends to strengthen whatever is ailing you as well.
Oh, really?
So if you've got a cold, or if you've got, a bacterium that shouldn't be there, or a virus that shouldn't be there, it could make that stronger too. So it locks everything in and creates a barrier towards what's coming at you from outside. But you don't want to be tonifying things unless you're clear of whatever is ailing you first.
So what do you consider a tonic? So vitamin C is a tonic?
No.
Oh.
Vitamin C is an antioxidant. So vitamin C is, all right, but a lot of the multivitamins, a lot of the immune boosters, this will boost your immune system. That, people also that have pre-existing conditions or any type of autoimmune disorder, you don't want to over-tonify your immune system, because people that have autoimmune, meaning their immune system is hyped up and on alert a lot more than people who don't. People that have cancer or have had, different things like that, their immune system just blows up at the first sign of a foreign, entity. They just over defends. And so what that tends to create in a person's system is too much inflammation. The body sort of catches fire. And so, a lot of the way the Westerners deal with it is by giving immunosuppressive drugs. And in some cases, that's the only thing that they can do, or steroids and things like that. The problem with giving steroids, unless they're absolutely under a doctor's care and necessary, is that they can then really suppress your own ability to fight things off more.
Right.
So you shouldn't be going for those unless it's really necessary. Like, you're in the hospital, the doctor's going to give you antibiotics and maybe some steroids along with your oxygen or whatever. And that's to help with secondary infection, but you don't want to be grabbing that stuff.
So what are some of your patients coming in with? Like, what kind of things are you helping them with?
I mean, I've had patients that I've had as far as COVID, and there's a really good, on my website, if you want to know what they've sort of done in terms of co-treating the COVID epidemic in China, the John Chen, who has Evergreen Herbs here in California, is an amazing Chinese herbalist. He's also a Western pharmacologist. He's really brilliant. He goes through the whole way that Chinese medicine looks at things that are COVID and how they treated it in Wuhan and the two hospitals. That's on my website. So it's really nerdy, but it's really interesting. So people have been coming to me with all kinds of different things. Everything from a sore throat to I'm sinusy to I've got diarrhea to I've got a fever kind of, but I don't know, to, mom's got a mucus plug, we don't know how to get it out, and I don't want to, should I take her to the emergency room type of a deal. So, I've had to say, yes, you must get your specialist on the phone. Do not wait, go now, there's, do this now. And possibly you can try, something that'll get the fever down a little bit before, and buy you a little time, maybe, because we don't know if any of this stuff really works now and for this virus. They do know in the Chinese way, there is a progression. They do know the progression of the disease pretty well. They do know that it starts at a certain, mild to no symptomatic point, and that it can end up with what's called a cytokine storm, which is what you do not want. And that, again, is where we talk about trying to reinforce the system to keep it from, just to keep overall inflammation really down. So I've been, besides the Chinese herbs, I think there's some really important and interesting things that are going on that I think have been a little bit overlooked, that I really am hoping that they're going to do more research on around all of this. One of them is vitamin D deficiencies, because not only does that help with, your bones, but it has a huge effect on your respiratory system. And, there's I think one protein in your nose, I'm not sure about this, but that's activated by D3. And if you don't, and people are being told, don't go out, don't go out. So the thing that affects our D3 is sunlight. You're stuck in your apartment for months at a time without any sunlight, or you're an older person who cannot absorb D3 well in their skin, or you're a vegan who can't do cod liver oil or anything, or you're a dark-skinned person. I think there's so much talk about, COVID really hitting the African American community so hard. And part of that is all the things that they're talking about, but they're not actually talking about, is this African American people who are also in, urban areas where, they're not going to absorb as much, sunlight, all of these different groups of people. So I have been telling people, really talk to your doctor or your, online, whoever it is that you're talking to, or your family physician, and ask them if maybe a vitamin D3 supplement wouldn't be a good idea right now. I think that's a really good idea. And as well as antioxidants and stuff. So I had an older patient that a lot of it is just the lack of testing. I had early on an older patient who said I could mention, who 85 years old, all the precondition, heart condition, chronic asthma, 85 years old, no sense of taste, no sense of smell, all of the symptoms, and no testing available anywhere. Went to an emergency ward. I was just, you got to get tested. You got to get tested. She went to an emergency ward during all of this, was tested for pneumonia, was tested for the flu, none of which she had, and was sent home. Talked to another doctor. No, there's not enough, you don't have enough of the symptoms. No testing. Finally, on the third try, because I was like, the squeaky wheel gets the grease. You keep squeaking, keep squeaking. And in the meantime, she's taking, herbs and all of the other things just so we can try and keep her steady. Finally was tested, and at that point was over the hump. The physician, the specialist, the pulmonologist, I believe, said, they really thought it was COVID, but that now she was kind of on the other side of it, and that these tests were at that time about 65% accurate. And so now they're setting her up to be tested when those come online for the antibodies. So, that's happened. Or, just people who are scared at any little sniffle, or just want to keep, I have people that are used to coming to me and just want to keep the respiratory system as strong and as clear as possible, so as not to further, weaken it should something come along. So it's been a big gamut of things.
Wow. Do you find that there's a lot of misinformation out there?
Yeah, there's so much stuff floating around. I think there's misinformation. I think there's disinformation. I think there's slow information. I think there's politicized. Everything is so politicized. And I'm just telling people, don't. There was the whole mask thing. Don't wear a mask. Only people. It will hurt you to wear a mask. There was that. It will hurt you to wear a mask, and only people that are in the medical profession should wear a mask. So your mask should go to them somehow. And so, it's a common sense thing, cover your nose and mouth, wear a mask. Don't wait for the politicians to figure out when to tell you to do these things. Stay away, physically distance. It's not social distancing. You want to be engaged socially. You want to talk to some, is social distancing, what does that mean? Does that mean I shouldn't talk to anybody?
Right, I know.
Yeah, you should talk to people. You should engage with people. You should feel, make yourself happy any way that you can socialize. But it means physically distance from people, physically, and not just 6 feet, as far away from them as you can get if you're moving.
Yeah, it's an arbitrary number where they get the 6 feet from, but
I think that's as far as spit can spit. I don't know. but really that's a standing still number. And I think it was on one of the weather channel things where they explained kind of how that works and how these things travel if you're moving and how far apart people should be if they're moving. And that was very interesting to me. So yeah, I mean, there's a lot of good information out there too. And, things are coming up all the time, but people should be so careful and really, try to see somebody that's trained, in medicine. Try and be in touch with at least, a telemedicine person. If you want sort of things that might go along with that to help you and your overall health, things that if you've been ill and you're kind of on the way back. I mean, where my medicine can really help people is not when they're going to be in the hospital. That's out of my hands. That's, you really have to contact your Western doctors. You really have to, lobby for it, I have found, before they'll even take you in some, because they were so worried of getting overwhelmed. People were very reticent in different states of even taking people in.
Right.
Even if they had, the heart conditions and the things like that. So, make noise, talk to your specialist, talk to your family care physician. And then if you need some help, knowing what foods are better for this time of year, knowing what's going to help maybe buy you a little time, maybe. I can't even, it's the same things that we've been using all along. There are certain herbs that have been tested, like ISATIS root, and leaf, Dachine Banlangan. Those were not traditionally ancient Chinese herbs, but they're used extensively now, and were used a lot during the other coronaviruses and SARS and things like that have been tested, and they do have antiviral properties. So you can look that up, but don't just go and take it.
Right.
You should really talk to somebody who is, make sure it's safe for you, because it can be like detergent. It can be very hard on the digestive system for some people. And so you have to make sure that it's dosed properly, that it's mixed properly, that it's in a good form. But there are herbs that do have these. They don't distinguish a lot of these herbs between antibacterial and antiviral. We use them kind of interchangeably a lot, because they're a full herb, so they tend to have both types of properties, and we just use them. We call them clear toxin herbs. And so these types of herbs are used really extensively for, these types of swollen glands, little fever, sore throat, sinus infections, ear things, ear, nose, throat, upper respiratory, tummy trouble. They're used a lot, so it's not unheard of for us. But again, it's not a cure for COVID. It may be, until you get in to see some, it may be a way that you can, get through these hard times in your home with possibly less, discomfort. And it may, I do not know, but it may buy you some time before you can get in to see your specialists or your MDs or people that can offer you something else like oxygen or whatever.
So then you put in a prescription with a Chinese herbal pharmacy or that sort of thing?
This has been really challenging. I have an online apothecary, and I have, of which nobody has ever, if I'm doing a consult, I'll try and square them out with a protocol, whether they can get those things or not, because they're flying off the shelf, all this stuff. It's really hard. So I'll tell people, look, you can try and get it from my suppliers if you want. I'll make that available to you. You can try and find the same thing online somehow. Let me know if you succeed. Some of the things are more available to people. Some of the things I have to special order, because some of the herbal companies we're not going to let any of these out unless they're seeing somebody.
As we wrap this up, is there any kind of, words of wisdom or advice that you have for people who may be anxious about getting something, or they have light symptoms?
There's so much out there. It's just really common sense. And you said a lot of it. You have to keep your hygiene up. And that not only means hygiene for your hands and getting things, that means your organ hygiene as well. So if you have little somethings that you can treat before they get worse, if you feel like, you are experiencing seasonal allergies, or you do have, a sinus infection, or you do have a little sore throat, or your tummy trouble, handle it. Take care of it. Get online to see somebody, do a consult, do something for it. Eat comfortably. People that have been sick, I would say that they need to eat really assimilatable types of foods, very, soups and broths, and, in Asia, congee, porridges and things like that, things that are well cooked and easy to digest, so that your body doesn't have that on top of it. Oh, I just had, this very rich meal with, all of the wine and the thing and the stuff in the boxes to deal with when I'm just trying to get well. So you want to keep things really simple. There are some very specific things to eat for lung health. And this is something I want to share with you. Just to get in Chinese medicine, every organ system has its season that it's the strongest, has a flavor that goes with it, wow, has a color, has a place where it goes. So we say the flavor of the lung is spicy and acrid, and I'll get into what that means. The color of the lung is white, and this is just so people in school can remember. This is so we can learn, right? And the season is like now, right? In spring. So well, in fall and spring. So we say you want to eat the spicy acrid foods are things like radishes, things like root vegetables that when you cut them open, they're white on the inside. Yeah. Things like ginger root, things like onions, garlic, rutabagas, turnips, radishes, jicama, things like that have that. It's not hot and spicy because that can close the throat up. It's just sort of something that might make you sweat a little bit. And so sweating a little bit can, opens the pores, which in Chinese medicine is considered part of the respiratory system. It can get you breathing a little bit deeper. It can help, a little bit with sore throats and things like that, and swellings. Get your nose to run, So that type of thing is something that I really like to deal with people, because everybody has food and everybody's, eating stuff right now. So if you can add those either in a slaw, which there's a recipe on my website for for people that are vegan, a vegan white root slaw. Okay. And then there's also one, because I'm a chicken soup kind of person, and that's also, bone broths and those good broths that kind of help buck you up with the root vegetables in it. So those are on the website. There's a recipe for those. So just make a big pot of really comforting food, but make it nourishing for yourself. Feed yourself, comfort, instead of just, I'm going to eat the brownies and I'm going to have the chips and I'm going to drink the Cokes and things like that right now.